Welcome back. This is Newslink on eNCA. If you've just joined us, the time has hit 19 minutes past 9. Now, the National Consumer Commission has launched a full investigation into sanitary products sold in the country. A university study at UFS, the University of the Free State, has found hormone-disrupting chemicals in several brands of pads and panty liners marketed as safe. The Trade and Industry Portfolio Committee says women's health and safety must come first. But what options do women have, and how do they choose safer products? Menstrual health rights activist Nokuzola Ndwandwe and a Trade and Industry Portfolio Committee chairperson Mzondile Masina join me now to discuss this. And a very good morning to both of you. And in fact, I'm going to start with you, Nokuzola, and ask you the question. As a woman, when you first heard this news, probably with one or two products or some products that you might have used over the last few decades in your life, how did that make you feel?
Thank you so much for having me on the show. So we've had exposure to this research, which is done from an international perspective, but also from our own lived experiences. Having experienced some form of rashes or some form of bacterial infection from using these recognized multinational brands. I took a stand, I think, a few years back in 2023, whereby I also started educating young girls and women in rural communities through our workshops with team-free sanitary pads, with the contents that are contained in menstrual products and the dangers that come with the contents that are contained in menstrual products. So my feel was that to bring about awareness, to bring about more conversations, but also to bring the matter forward to Parliament, as I have been doing the presentations for over 2 years now. I remember presenting to the Portfolio Committee of the Department of Women, Youth and Persons with Disabilities in 2024, and I expressed the concerns that the menstrual products are actually of poor quality, that are actually sold in our economy, and this needs more investigation, and this needs more regulation, hence our calls for a menstrual health rights bill and law.
In 2024, you'd already presented to the Portfolio on Women. Wow, that's quite interesting. Mzondi, let's bring you into the conversation as well, because I think it's important that we get the perspective from the committee of the Trade and Industry. Millions of women do use these products daily. Mzondile, why investigate first and not recall immediately? Is there a threshold for recall? What is it, if there is?
Well, thank you very much for this opportunity. First, that when the NCC became aware of the study, immediately they arranged a meeting with the academics to explain the findings and implication of these findings. Because we're told that there are some limitations to the study, it was found to be imprudent to immediately take enforcement actions just based on the study. And then what was then suggested is that we should initiate an investigation in terms of Section 712 of the Consumer Protection Act to allow the process to formally request the information so that we're able to deal with this particular evidence. The study on its own would not have met the evidential threshold for immediate product recall or any enforcement actions on our part. So therefore, it was important that we request that the firms must conduct tests as well as through independent laboratories to assess the presence of any mentioned chemical in the sanitary pad. So this is where we are with regards to this particular issue.
Now, I hear you, Mr. Masina. So the next question really is, what should consumers do in the interim? Because it's been identified through research done in an academic institution, a research institution, that these products are not safe. What is the threshold for recall, and what should consumers do in the interim?
Look, what's going to happen within the month, the decision will be made on the interim measure that must be taken, because this is a very sensitive issue. As you can hear from the fellow panelists, that this issue is not something that could be taken lightly. So because the investigation itself, these tests that we're talking about were informed by our technical teams that it could take up to about 6 months to conclude, to have a conclusive study with regard to what is being found. So within the next 30 days, the department through NCC would have acted to ensure that we save women from this issue that has been experienced.
I hear you there, Mzondile. Thank you very much for that. Nogzola, on your side, in terms of what women should do, what would you recommend consumers that require these on a daily, monthly? What should they be doing? Should they stop using them immediately? Are there alternatives that you might be able to suggest?
Definitely. I suggest that women stop using the brands that they've been using immediately, especially where women have experienced some form of discomfort or some form of heating or rashes, because it's not something that they are imagining. It's actually a real lived experience. And so I'd suggest that women perhaps use alternatives like organic menstrual products that are made from organic cotton, that are actually chemical free and actually have the AOK Tex 100 accreditation, and also make use of reusable menstrual products that actually have antibacterial content in them. But also, when making use of these reusable products, they should be very cautious that they make use of proper hygiene when it comes to cleaning and drying up the menstrual products. So in the meantime, I feel like women should actually be very careful. They should not dismiss whatever discomfort and actually treat their women's health issues with the most utmost care and attention.
Look, if somebody has used these products for years and gotten comfortable with a certain degree of discomfort, it might be difficult to then make a call on what they should just soldier on with, if I could use those words, for lack of a better phrase, on what they should actually be taking seriously and trying to see, is there a real issue? Should I be looking for an alternative? What do you suggest? When do you think, is it immediately on feeling discomfort, or do you think that they should actually consult with their GP, with their health practitioner as they make these decisions?
Absolutely. If they can, if they have the affordability level to actually consult a gynecologist, True. That will also be very helpful, because, you know, the discomfort may feel sort of like they may have felt used to the discomfort. However, the long-term effects is that they are exposing themselves to, you know, endometriosis, cervical cancer, and other forms of, you know, health concerns and menstrual irregularities. For instance, some women may experience menstrual cycles that are not regulated due to these hormonal disrupting chemicals in the menstrual products, and they often come forward and they ask questions. Yep. Is it normal to bleed for more than 7 days? Is it normal to experience these type of conditions? And so, which is why I encourage that women move towards organic cotton content in menstrual products, rather than these synthetic fibers or the plastics that are contained in products. And also, it's very important that they make use of products that are breathable in nature, so that, you know, the chemicals or the chemical reaction that happens when a woman is going through that time of the month is not impacted on the woman when it comes to menstruation.
No, thank you for that, Mzondile. Let me bring you back into the conversation and check two things with you. Who's independently verifying the findings by the university research, as well as, if the findings are confirmed, will the manufacturers face penalties?
Of course, I think they will face penalties in terms of the Section 112 of the Consumer Protection Act, which stipulates that you can be fined 10% of the turnover, or about R1 million, whatever that is higher, in terms of that. We are using, quite as you know, that in the DTIC itself, we have quite a number of institutions, including the National Metrology Institute of South Africa, SABS, and many others. We will be working very closely with SAPRA. Our officials are going to be working very close with SAPRA to ensure that we attain independent views on the study, but also on the test of the product, so that we can be very conclusive, as you have heard, that this is a very important issue that requires urgent attention on our part.
I hear you. In fact, the next thing that is really quite important to understand is some of these products are not used in South Africa alone, they're used globally. What are the standards that are being applied in other parts of the world, in other markets that they operate in Europe, in the United States, for example, and are they the same as what's being applied here? Why, if so, why are they in Europe not complaining about the same thing that we have an issue with?
Look, we were part of the World Trade Organization. We have sort of standards that have been generally agreed to. I think that it was within the right of the academic institutions to make this observation, which has helped us as authorities to make sure that we can do proper follow-up and ensure that lives are saved.
Oh, no, I hear you. In fact, you wanted to come in as well.
Yes, I wanted to come in there. Actually, it's a global issue. The safety around menstrual products and the contents contained in the menstrual products is a global issue. There have been complaints globally of women coming forward and saying that the products that they are using, these well-recognized multinational brands, are actually impacting on the woman's health. When it comes to that time of the month, they experience rashes, they experience discomfort, they experience heating. And it's something that's been discussed all over Africa as well. So we really do need the investigation, but we also need some form of, punishable action, some form of urgent action to say that we need justice for, all the women and young girls impacted by this, the chemicals contained in the menstrual products. Because first of all, women cannot access, menstrual products, and then once they have access to the menstrual products, it's menstrual products that are of poor quality and they're not regulated. The menstrual products are treated as a luxury and not as a health essential. And so it creates this vicious cycle of period poverty, whereby women now experience menstrual health related illnesses, and yet they cannot afford a gynecologist, they cannot afford their health living needs, also owed to gender pay gaps. So it's something that needs thorough investigation and that needs regulation.
No, thank you very much for that. Much appreciated for this conversation. So no recall yet, but a formal investigation is underway with pressure for urgency and transparency. That was menstrual health rights activist Ms. Nokuzola Ndwandwe and Trade and Industry Committee Chairperson Mr. Mzwandile Masina.